So the immunodeficiency stage, that includes all the opportunistic infections.
But its basic mechanism is that
and those are not the symptoms of AIDS. Those are the symptoms of the opportunistic infections. So the AIDS includes all these kind of symptoms in the acute stage.
Okay.
Right. So did everyone get the meaning of clammy here? Yeah? Maybe you know what clammy is? Cold and shiny skin. Cold and shiny skin. John, do you know what clammy is?
Cold and shiny.
it's wet. The skin is wet. It's excessive perspiration and there's pallor and wetting of the
You were
skin.
saying something earlier.
It's wetness and the coldness of the skin, that is, you call it clammy. As in shock conditions. Yeah. Excessive perspiration.
Right. How would someone look up clammy? Like, did you think it was important?
Not for HIV.
Yeah, so you were saying preparation, right? So sweaty is actual.
Okay. What is
Okay. Someone said fever, someone said cold, others said, I don't know.
Why are we giving so much?
Because it's a symptom mentioned on your scenario, you should know what it is to be related to the diagnosis.
It is 2:45.
Okay, and now let's talk about the.
Which occur, and by this staging we can actually, it's easy for us to use antiretroviral therapy.
Yeah, can you tell us the time intervals also along with that? Do you know them?
The stage 1 is for few weeks. And stage 2, I think it varies actually. It can be from different years, from up to 10 years.
Sarah, it's 4 to 8
10
weeks.
or 15 years,
Stage 1.
stage 2.
Stage 1 is, I think, 4 to 8 weeks. It's 4 to 8 weeks in Davidson.
ठीक है, तुम वो करो, हमारे पास ठीक है, please करो.
And what was stage 3?
Till you die. Are you sure stage 2 is 10 to 15 years?
No, this if weight loss goes on for 10 to 15 years, or it appears
I
after
think
it would.
stage 10 to 15 years. Right.
This one is fine. Okay, anyway.
This is 10 to 15 years. And
Okay, you need to confirm this.
okay,
I'm not sure, but this is important to come back to the next.
because this is another classification actually.
Alright.
There is one classification which I like. Second infection is for traumatic stage, which is for 10 years, and the stages and
Alright, okay.
Okay, now these stages are for us. It's for us so that we can easily diagnose it, and treatment can be made properly for that. So in stage 1, it is asymptomatic. There's general lymphadenopathy in that. Stage 2, there's unexplained moderate weight loss. Recurrent respiratory infections, therapy zoster control, and there's papillary eruption, oral ulceration, fungal infections are there. Okay. We can see that these are not very major symptoms. And stage 3 is unexplained severe weight loss. There was moderate weight loss. Here is severe weight loss, diarrhea for longer than 1 month. Again, our oral dialysis, low-leukemia, severe weight loss, below 8 grams per deciliter. Low pressure, and chronic pneumonia is below 50 billion. Now, stage 4, which we call as the
Immunodeficiency stage.
in which there is and most late stage, like pneumocystis, extra TB, sarcoma, toxoplasmosis, lymphoma.
Is there any
I would like to graph.
Do you know, can you track these stages? Because if you know the time interval, know the CD status, how can you ever, diagnose a patient?
Okay, I have a graph. I'll.
Then we will raise this part. Are you progression on the other side?
Two colors.
And then it becomes more progressive.
And by the way, we can have
Okay. In this graph, this graph shows the viral and the immunological picture. In this, on this side we have the CD4 count, and on this side we have the load and the time. Now, as we see in the when we load, it increases suddenly in the acute infectious stage, and then it decreases when the CD4 count at this time, when we see the relative CD4 count increases, and then the viral load drops because there is still a persistent increase in the 4 count, and then as the CD4 count is dropped, you can see that there is a persistent increase in the viral load. This period is
It's the other way around. The viral load is increasing, which is causing the CD4 to drop, right? Because the virus is causing damage to the immunity, right?
Yeah, okay.
You know,
Okay. Yeah. Okay, because the viral load is increasing, the CD4 count is dropping, and in this stage we can see that because the CD4 count is dropping and now the symptoms are starting to manifest themselves. They can be minor or no symptoms at all, and this is the main infectious period. And then over here the CD4 count has dropped to below 10 to the power of 4, which if it goes so that can lead to death, and the viral load increases. Okay, in this stage, the stage 1, that is symptomatic of the adenopathy, that occurs in this stage. In this stage we have generally no symptoms at all, and this is just the incubation period, and the antibodies are not detectable in this period as well.
7 to 10 is years or weeks?
7 to 10 is months, I suppose. Okay, and then after that what happens is, then we come to this, in the minor or asymptomatic, the first stage starts, in which we have the generalized activity. Then comes the 2, that starts progressing towards the later stage. It comes in this towards the later part, the viral is increasing. Stage 3 as well, and just one second. Okay, and the stage 4 would be probably somewhere near the end. That is when the CD4 count is going below the 10 raised to the power of. And in this, what we have is there is a period and there is a window period. And in both the incubation period, of course, the antibody is detectable. In the window, also the antibodies are not detectable, because in this time the seroconversion has not yet occurred. And though the viral load is there in the blood, that we can see. Though the viral load is there in the blood, but still, and the person is infectious in this stage, we cannot detect any antibodies at this time. So this is a very dangerous period, because you have no symptoms, you have no lab tests to confirm, and plus but the person is carrying the virus around and can transmit it very easily. And then the rest of the graph is.
Yes, I was just thinking, because they are saying there is no way you cannot detect the virus. You can detect the PCR. That's understandable.
No, in the first.
It will not detect antibody.
I was saying with the antibodies.
Yeah, I know she said that there is no lab available, but she has.
I meant to say that the normal blood test the antibodies for the virus. Yes.
That's what. Okay, and someone else wanted.
So the CD4 count is actually related to the viral load?
Yeah, the greater the viral load, the greater it will multiply. It will cause damage to the CD4 cells, because it is using the CD4 cells machine to replicate. It will cause, by using its machinery, it is causing damage to the cell itself by and replicating on, and because it's caused when it is using the CD4's machinery.
So we can say in general CD4 count is inversely proportional to viral load.
It's not. We could
So
say.
when it's high, the CD4 count is low.
Yeah, because.
Yeah.
Yeah.
Okay, in general terms, it is like the common sense says that when the viral load, definitely it would cause a damage and cause a decrease in the cell. But I don't think that it would be directly like proportional. Somewhere the data would, of course, differ. Yeah.
You said the viral load, and you made a graph like the CD4 count is falling. How are you going to rate the viral load is going to be the number of the CD4 cells infected, or what do you mean by the viral load? Is it going to be the virus you're talking
That is
about?
the number of the virus particles in the blood, the
In the
viremia.
blood?
Yes.
Like particles are like replicating, or just they're sitting in the blood?
They are just there in the blood. That was there in this graph was taken from Davidson, and the viral load, as far as I know, is the number of the virus particles in the blood.
Not or in the
Yeah.
cells?
In the blood.